This is WPSL Port St. Lucie, the talk of the Treasure Coast.
Views expressed on the following program are not necessarily those of WPSL. However, you're encouraged to like and share them on Facebook because it's time for Joanne's World of Nutrition in downtown Fort Pierce across from City Hall in the all-newly named Kraz Square, formerly known as the Arcade Building, in Suites 118 and 120. And now, here's your host, Joanne Seeger.
Good morning, everyone. Happy Thursday. I hope everyone's having an incredible morning. I am super excited about today's show. I have an amazing guest that is going to be joining us in just a minute. But I just wanted to make one announcement. Well, first of all, I wanted to say thank you for any newbies listening. The show's been on for many years, and I love when new listeners join in. And the show is typically a live call-in show, but today's special guest, we really want to just let him get as much information out within the hour. So if your question is related specifically to the topic, please call in. But if not, we'll hold calls till next week's show, and then I'll answer any of your questions. And also, don't forget, February 8th is our open house for the new wellness side of the health food store. So we have 4 new treatment rooms, infrared sauna, ion foot detox, raindrop technique, biofeedback, lots of cool cutting-edge holistic therapies. So come in February 8th and check them out, 3 to 7 p.m. I'll have a little healthy hors d'oeuvres served and prizes and special discounts, and some of our practitioners will be there to say hi, do a meet and greet, so you don't want to miss that. That's February 8th. Okay, here we go. Our guest today is Dr. Peter Atch, and he is a medical oncologist. Yes, I said that right. Medical oncologist. It's not usual that I have doctors on my show, but this one definitely is cutting edge. He's been practicing oncology since 1993, but he is really, he took me by surprise because honestly, even though my father-in-law is a physician and I do have doctor friends, a lot of them are mainstream thinkers, but Dr. Atch is thinking outside the box, which I'm thrilled about. So today's show is going to be about his mission and his products that he made to follow that mission. So without further ado, good morning, Doctor. How would you like to be called? Dr. Peter, Dr. Atch? I know you're a pretty casual guy.
Just Peter is
Just
fine.
Peter. I love that. That's so awesome. Sure. Another great thing about you. Well, Peter, thank you so much for joining us. I really appreciate you taking time this morning.
Well, thank you for having me. I really appreciate your time and inviting me to your show.
Well, thank you. And you're in Orlando this morning?
I'm in Gainesville, Florida.
Oh, Gainesville. Okay. So not too bad. You're enjoying this little cooler weather we're having here in Florida, right?
Definitely.
Yeah, nice sun shining. Well, we normally start our radio show every Thursday morning with a breathing exercise, but I want all my listeners to just do that exercise while we get in all this great information. And Peter, can you take a few minutes to just kind of tell us your background and how it all began?
Yes, I went to medical school in Hungary, Europe, and right after medical school, I started working as a medical oncologist. I got the chance of working at the National Cancer Institute in Bethesda, Maryland, soon after starting working, and I, took that opportunity and went there, where I spent over 5 years in cancer research. I have an MD degree, but I also have a PhD in cancer biology and molecular biology. After the National Cancer Institute, I finished my residency and a medical oncology fellowship at Georgetown University in Washington, D.C., after which I started to work in community oncology, seeing patients across the board from benign and malignant hematology to all kinds of cancer cases for over 10 years. The last couple of years, I've been concentrating more on nutrition, which is an amazingly neglected area in medicine, even in cancer patients who really need it the most. So I saw so many people during my practice basically wasting away and coming to the office with a lot of fluid retention, with low protein, due to multiple issues that, we will talk about that cancer patients face. And there's really no good nutritional supplement that we could use that has no harmful effects and has a good protein and other factors that these patients need. So I decided that I will delve much more into special nutrition for the special patient population, including cancer patients, and come up with scientifically formulated nutritional supplements that based on scientific data and have all the ingredients all put in one that a certain patient population like cancer patients need during chemotherapy or when they're losing significant amount of weight.
Well,
That's where
I am sure there are many patients and people in the community that are very thankful for you, but me especially, I've been in the field of nutrition for over 30 years, and I honestly have discussions on a daily basis with people that I'm nervous about suggesting anything if they're in cancer treatment, if they're getting chemotherapy or radiation, because most of the time throughout the years, if I was even very, just one basic product, they would come back and say that, their oncologist did a blanketed statement of nothing, no supplements at all. And I didn't have the research or medical degree to feel confident to say, well, this is okay. And you have spent so many years making sure that you had the white pages, the medical research, the data, the science behind your supplements so I can say that now. I can say this is
Correct.
safe. This is something that someone in that field is recommending. It gives me such ease, because unfortunately now the rise of cancer and the amount of people coming into the store that are under chemo and radiation is definitely increasing. And
Absolutely.
Yeah.
I mean, cancer is rising. The next decade, it will rise by 70%. And right now, it's 2 out of 5 people who will have cancer in their lifetime. We also live longer. We diagnose cancer much more efficiently than previously. But nevertheless, the actual number of cancer is growing due to multiple factors, of course. So yes, as you said, cancer doctors, they are usually very weary about using any kind of supplements. They don't want them to interfere with treatment or cause any other problems. But everything that I have and I've done and put in our supplement has been shown to be beneficial in cancer patients specifically, in chemotherapy, and none of them interfere with any sort of chemotherapy treatment.
Yes, because when you're diagnosed, the peace of mind to get at least for one part of your life, that knowing that everything you're about to ingest is safe and is going to provide a benefit, that's a little extra security for your day. But some of my listeners might be real young or total newbies into nutrition or the word cancer. It's a scary word, but some people really don't know what cancer actually is. Could you tell our listeners just the basics of a cancer cell?
Yeah, absolutely. Normally, normal cells grow in the body all the time. I mean, there are cells that are dying, and there are cells that are growing at all times. There's a normal turnover in the body, which is a very strictly regulated process. Now, occasionally, some of these cells, which can come from any organs, any type of cell, break out of this regulation and they start growing without control. Now, then these cells will form, little tumors, which could still be benign, but once they continue to grow and mutate, they learn the ability to grow into surrounding tissues. That's when we start talking about malignancy or cancer. So these are cells that grow out of control, and they're aggressive, they grow into other tissues. Eventually, they also learn from further mutations to move and settle in other organs where they also start to grow. And that's why we talk about metastatic cancer or stage 4 disease. So these cells are different in many, many ways than normal cells. They are virtually immortal, and they're aggressive, and they eventually take over the whole body, causing a lot of problems. And that's where, all the problems and the weight loss and all come in.
Okay, and now the chemo and radiation, I know that there's usually 3 different times that's prescribed. Could you tell us about the different reasons that an oncologist would prescribe chemo or radiation therapy?
Yes. Radiation treatment is either used for a very localized disease or for a local recurrence or for severe complications or side effects, like a cancer is compressing on the nerve and you need relief. Radiation treatment is also used in what we call adjuvant setting. Adjuvant means that cancer is already treated. There's no evidence of disease, but we want to prevent it from coming back. A typical case of this is breast cancer. Breast cancer patients would normally get all 3 types of major treatment for cancer: surgery, chemotherapy, and radiation. Surgery can be done when the cancer is stage 1, 2, or 3 in general. That means it has not moved to other organs. Stage 1 disease is typically a small cancer with no evidence of disease in the surrounding lymph nodes. Stage 2 is typically a bigger cancer and usually still no, depending on the type of cancer, usually still no cancer cells in the lymph nodes. Lymph nodes are the first protective cells, if you will, or it's the organs that are like a filter. If the cancer starts moving, they get caught up in the lymph nodes, and before they even metastasized, move to other organs, the lymph nodes will pick them up and kind of capture them. So whenever, for example, again, breast cancer, we take out the primary cancer, we look at the lymph nodes. One that's called the sentinel lymph node, which is the first lymph node that area where the cancer is drains to. And if that lymph node has some cancer evidence, then they do a more wide, more aggressive surgery. They take out more lymph nodes. So those are typical stage 3 disease. Now, stage 4 disease is when, as I mentioned before, the cancer has moved to other organs. Chemotherapy we use in 3 different settings. One is the already mentioned adjuvant setting, where a typical case would be, again, breast cancer or colon cancer, when the surgeon takes out the relatively earlier stage, 1, 2, or 3 cancer, and then chemotherapy is either indicated or not. In stage 2 and 3 disease in breast cancer, it's indicated, and the goal of the chemotherapy is to prevent the cancer from coming back. Now, these indications come from many, many studies in tens of thousands of patients where the benefit has been shown. This is called adjuvant treatment. And then after chemotherapy in breast cancer, frequently, based on the indication, one does need radiation again to prevent it from coming back. Now, chemotherapy, we can also use what we call a neoadjuvant setting, where it is prior to surgery. And the goal of that is to make the cancer amenable to surgical resection. So we have a large breast cancer, for example. Let's stick with that, the most common cancer in females. If it attaches to the chest wall, for example, or it's very large, frequently we do neoadjuvant treatment, where you treat the cancer with chemotherapy and sometimes with immune therapy as well at the same time to shrink the cancer. And once it is shrunk, then it becomes amenable to surgery without residual disease. Now, if there should be residual disease, that is taken care of with radiation. And then the third setting is the metastatic setting, which typically surgery is not done because the cancer is already moved to other organs, which typically are the liver, lungs, or bones, occasionally the brain. Then surgery is not indicated unless there is something that needs to be solved because it acutely can cause demise. And then surgery is a palliative surgery, which means it's to stop some severe side effect or complication and make quality of life better. Chemotherapy is the treatment of choice in metastatic setting, but occasionally we do use radiation, especially if the metastasis is in the brain, where chemotherapy typically does not go to due to the blood-brain barrier. So these are the major areas where treatments and chemotherapy are used.
Now, you just mentioned quality of life, and I know that's the goal of the company you created. Can you tell us, I love the name, by the way, Nutronco. So for anyone that just joined us, we have Dr. Peter Atch on the line with us, and he is the founder, he's a medical oncologist and founder of a company called Nutronco. And I love it. Nutrition and oncology, like how perfect. And you are striving for these patients that are choosing the chemotherapy and radiation to have a better quality of life because the side effects of the treatment sometimes is horrendous. And so can you tell us about some of the side effects and how nutrition plays a major role in helping them?
Yes, this is basically the whole issue. And it's not just the quality of life. I will get back to that we're trying to improve. So these cancer patients, they face a variety of problems, a combination of different problems that all create a vicious cycle. Muscle wasting, decreased immunity, inflammation, debility, problems with the GI tract, the leaky guts, nausea, vomiting, diarrhea, further deterioration. And this vicious cycle will eventually lead to the cancer weight loss, what we call cachexia, and their demise. So this cycle is what needs to be broken. And one of the key elements to break this cycle is nutrition. Now, chemotherapy will further deteriorate this because chemotherapy is like treating cancer with a shotgun. It does work on cells that grow because the target of most of the chemotherapy treatments are either the DNA or the microtubules or something that helps the cells grow. That's how it stops the cancer. It stops them from growing. But there are other cells in the normal body that grow. The hair is well known. That's why people lose their hair. But more importantly, the inner lining of the GI tract, the gastrointestinal tract, the guts, in other words, all the way from the mouth to the anus, there is a normal turnover of those cells at all times. And the chemotherapy stops this. And as a result, the body will become open to the outside through the guts. And all kinds of things and toxins and bacteria can go into the body through these leaky guts. The third important and very important organ is the bone marrow. We make blood all the times. The little platelets that help us with blood clotting, they only live for a week, 8 to 10 days maybe. Red blood cells live for 3 months. White cells may live just for 12 hours, some of the white cells, the neutrophils. So the bone marrow is suppressed by chemotherapy, and then there's no white cells, there's no neutrophils to prevent bacterial infections, and people can get severe infections. And together with the leaky guts and the malnutrition, this can cause very severe problems. So not just that people already have a vicious cycle of different problems, the chemotherapy will further add to that. So our goal is, on the one hand, to improve certain chemotherapy side effects, like the nausea, and protect organs, like their ingredients in there that protect the liver, the heart, the nerves, but also to alleviate the problems. Very important, and that's a separate issue that I'd like to talk about, is the muscle wasting that these patients will have. And this is an important issue because it also happens in patients that are potentially curable or cured from their cancer, and they still have a higher mortality rate if they lose muscle mass during treatment. So our goal is, on the one hand, to improve quality of life, on the other hand, to improve the patient's response to chemotherapy so one can get all the treatment and at the proper dose. There are ample data that show that one who does all the planned treatment will fare much better and has a much better survival than those patients that have to skip treatments, decrease the dose, or stop chemotherapy altogether. So we're hoping to improve that and make sure that people can get all their treatment that's necessary and prescribed. So what we're doing is not an alternative treatment. It's a complementary treatment, I won't even call it treatment, complementary nutrition that helps people tolerate and go through chemotherapy with a better quality of life, with a better tolerance of treatment.
Wow, that is a perfect, easy to understand explanation. Thank you for that. And it's perfect timing. We're going to go to our mid-break, but for any listeners, just hang on tight. When we come back, we're going to talk more about chemotherapy and nutritional support during that time with Dr. Peter Atch from Nutronco. So stay tuned. We'll be right back.
This is WPSL Port St. Lucie, the talk of the Treasure Coast.
Now back to Joanne's World of Nutrition. Once again, here's Joanne Seeger.
Hey everyone, thank you so much for listening this morning. I really appreciate everyone's time, but if anyone needs to scoot out of their cars or wherever they're listening from, remember Cliff is sweet enough to put all my shows on YouTube. So don't fret if you're missing a word of this. You can catch it in a day or so on YouTube. And this morning guest is amazing, so you definitely want to listen to the entire show. So it's Dr. Peter Atch. He's a medical oncologist, and he is the founder of a company called Nutronco. And the second half of the show, we're going to discuss one of the products that was specially made for use for nutrition therapy during chemotherapy. And that product is called Power Onco. And Power Onco, when it was first, shown to me, I was like, oh, another protein powder, please, just don't even bother. But then I actually read the ingredients, and I knew that there was a lot of thought and a lot of research that went behind this product. So the second half of the show, we're going to discuss why all these different things were put together and how it will support someone in cancer treatment. And on that note, I mean, really, everyone can use this product. It doesn't have to, you don't have to wait to unfortunately get chemotherapy, to use it. It's delicious. It's so good for you. So Peter, so Power Onco, tell me, what was your first thought and how it came about?
Well, the way it came about was my frustration when I was seeing my patients having all these problems, losing weight, and there was really no good nutritional supplement out there. Most supplements have, 50 grams of sugar.
Yeah.
Either they call it glucose or sucrose or maltodextrin. A lot of people don't know that maltodextrin is actually a sugar polymer, and these companies put 5 grams of sugar, but 45 grams of carbs, which is maltodextrin, which is really a pretty toxic substance. And most of these nutritional supplements that are out there have that, as well as they are soy-based, GMO, and also the other vitamins, electrolytes are just not enough for cancer patients. Cancer patients have a very special need, and they don't even make the what's called non-essential amino acids that normal people are able to make, not to mention the essential amino acids that are extremely important. And again, the intake of food and vitamins is much less. So there's a lot of need for special nutrition. So as I mentioned, I delved into it more, and I put together a supplement that has what I thought was really necessary and scientifically proven to help, to support, to protect in these patients without causing any problems and without interfering with any type of treatment that they may be getting. Now, a few things that I like to talk about, and feel free to ask while I'm talking, because I tend to.
No, I love it. Really, keep going. I'm hanging on every word.
The one thing, and the first and most important thing, is the protein. Protein is very, very important in cancer patients. Protein in general, in all of us, is what keeps the serum, the fluid part of the blood inside the blood vessels, the osmotic pressure, how it pulls back from the tissues. And if you have low protein in the blood, the fluid will stay in what we call third space, outside the blood vessels, outside of the cells, and people will have leg swelling or fluid in the belly, ascites. This happens in liver patients, liver cirrhosis, because they are not able to make the protein because of the liver disease. But it also happens in cancer patients a lot, from malnutrition or liver toxicity or liver metastases. Protein is important for this. It's also important because cancer cells typically are not able to utilize protein and protein and fat, but they typically use basically only sugar for their metabolism. And this is something I'll talk about in a second. But first, I like to finish the protein. The muscle mass is very important. And people, of course, with metastatic disease and malnutrition, we lose a lot of muscle mass. Just without cancer, if somebody lays in a hospital bed for a week, you lose 10% of your muscle mass. And you'll continue to lose 10% every week you're in the hospital. Now, when you're in chemotherapy, you basically are frequently a couch potato, and you don't move at all, and you lose a lot of muscle mass. There was a large study from Harvard and Kaiser Permanente. It was published in JAMA, Journal of American Medical Association, in the summer of 2018. This study was conducted in over 3,200 people with breast cancer. These patients had stage 2 and stage 3 disease, and that is curable disease potentially. So these patients needed chemotherapy, but they had a curable disease with an over 95% cure rate. And the study showed that whoever lost muscle mass during their normal chemotherapy had a 41% higher chance of dying with the chemotherapy with the treatment. The patients who had a high fat also had a high potential, and people who had low muscle mass and high fat had an 89% higher chance of dying during treatment. Why is this important? Because this is the first large study that shows that muscle mass is actually important. And it's more important because these are curable patients with curable disease. So everybody who gets chemotherapy, to me, based on this, does need protein supplementation. Protein supplementation will help. Of course, exercise should help during chemotherapy, especially in adjuvant breast cancer treatment, and we well know that. We try to promote a holistic approach, and exercise is just as important, and then sunshine is important, for example, too. But nutrition-wise, a good extra protein, because we don't really take enough protein even without cancer, is important. Now, for muscle building, the best protein is whey protein because it has the highest branched chain amino acids of any known protein. Those branched chain amino acids, especially leucine, is the one that helps significantly build up the muscles. Now, it's also important how you purify whey. We are using whey protein, but the way it's purified is an ion exchange, proprietary ion exchange method, where really no other contaminants, if you will, are in there, just the proper protein. There's no casein in there. There is no, just because there's no casein in the whey, but there is no hormones, which is very important because there are a couple of studies that milk products are not good for prostate cancer patients and breast cancer because of all the hormones that may be in there. But the ion exchange method will not have the hormones, will not have lactose, will not have the fat. They will only have the protein and immunoglobulins. So immunoglobulins are also very important. So the first and most important ingredient is this special whey that will help with the nutrition. It helps with gut health. It helps with immunity. And most importantly, it helps with muscle mass, healthy muscle mass. So the muscle is one of the targets that we have. The other and very, very important target is the guts. Not a lot of people know that the guts have around 80, occasionally 90 in some studies, 80 to 90% of our immunity. Not surprisingly, because other than the skin, the GI tract, the guts, are the only ones that are in close contact with the outside. Basically, anything we put in our mouth and we swallow will go through our guts. And there is a very complicated system with all the chemicals that are released in the guts that will stimulate nerves, and the nerves go up to the brain. So there's a whole axis. And if the guts are disrupted, the whole nervous system, the brain, and the whole body is going to get disrupted. Gut health nowadays is becoming one of the most important science in medicine. And there are conferences just for this. So, yeah, sorry.
Peter, gut health is my specialty, I feel, and it's so critical. And the fact that you're touching upon this and really the importance of it is critical. But I want to take a step back to the protein. Before I bought this health food store about 16 years ago, I was working with a company that made proteins. And not only did you touch on all the reasons why you should choose the one you chose, which is the only reason your product is in my store, but a lot of the protein powders out there are so dangerous. You know, they use these screens that, destroy the protein cell walls. And I know you're being so kind not to knock anyone else's product, but it's critical that you understand what Peter's saying, that don't just go out and take what he said about whey protein and, go to the big box store and buy this huge tub for $20. That's what he's saying. You have to get the one he mentioned because Nutronco did their research and there's just a small percentage left of healthy protein, and they do use the right one, because if you go buy whey protein out there, it could be dangerous. So really buy the quality whey protein. Do not buy those big tubs that are $20, and that could be dangerous. So I just want to clarify that. Sometimes people hear one word and then run with it, and so I want to make sure they weren't running with the whey protein and then just buying that. So
yes, that's a very good point, Joanne. Absolutely great point. Bottom shelf in Publix may not be the best way.
Yeah. Well, it's so true. And I know, we both agree that sometimes there are, physicians and even in senior homes that they recommend those little ready-to-drink protein drinks. I won't mention the name, but all they are is full of poor grade protein and sugar. And I know that, you mentioned always earlier, sugar feeds the cancer cell, and they love, gobbling it up. So you use xylitol, which is so awesome. I recommend xylitol every day. Of course, I use it in all my, oral health product. So tell us why you took sugar out and you're using xylitol.
Yes, I will do that. And after that, I'd like to mention a little bit more about the gut health, because I thought that's
Oh,
very
so sorry. I
Oh,
totally
no,
sidetracked
no,
you.
no, 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 no. This is good, because sugar is the third thing that I really wanted to go to. So cancer cells, sugar does not cause cancer per se. A lot of sugar causes obesity, and obesity is linked with increased risk of certain cancers, ovarian cancer, endometrial, breast cancer. However, cancer cells are very different from normal cells. Back in 1956, Otto Warburg, who got a Nobel Prize for his research, found out that cancer cells, use sugar even in the presence of oxygen. And the reason for that is because they don't have the enzymes to metabolize protein or fat. They love sugar. They love sugar so much that they accumulate sugar, and we use it in a PET scan that we diagnose to find cancer and to stage cancer. I don't know if anyone ever seen a PET scan, but basically we give a radioactive sugar, the cancer picks it up, and the cancer lights up from all the sugar that it gobbles up. So cancer cells do thrive on sugar. There are a lot of data, and more coming out, that if you use what's called a ketogenic diet, protein, fat, low sugar, or no sugar, the cancer cells may die. So ketogenic diet is actually a great adjuvant treatment. Other studies show that fructose, which is basically sugar, glucose and fructose, the body readily converts back and forth to each other, actually will cause the cancer to become more aggressive. It activates an oncogene called RAS, R-A-S, RAS oncogene. And this study was a 9-year study from Europe. So sugar is shown to activate an oncogene that makes cancer more aggressive. A recent study in Science, actually, one of the most prestigious magazines, was published, shows that colon cancer cells get more aggressive with sugar. So our supplement, because of all this, they do not contain sugar. They contain xylitol and monk fruit. Monk fruit is also really healthy and helps in many ways. And xylitol, which is a natural sugar alcohol, body actually makes some xylitol, protects the oral mucosa, the mouth, from ulceration. That's why they use it in elderly, in chewing gums, in nursing homes. It's really very good protective for the mucosa. It actually has some antibacterial effect, some anti-cancer effect. It decreases sugar absorption from the guts. And it's not used by cancer like sugar. So that's why we use xylitol. And monk fruit, which also has some beneficial effects in cancer patients and in diabetics. So both of these. So that's about sugar.
Okay.
One more thing about sugar is, you cannot live without sugar. You see it on the PET scan that other than the cancer, the heart and the brain lights up, because the heart and the brain picks up the sugar without any, energy used. They just go through, because you need sugar to think and for the heart to work.
Or for emotional rescue.
What I'm promoting is to avoid a sugar surge. So if you drink one of those ready-to-drink 50-gram sugars, you will have a sugar surge, and the cancer will gobble it up. Plus, you also will have insulin release, and the insulin is also a growth factor, and many times growth factor for cancer cells. So that's another way sugar will make cancer grow. So our supplement doesn't have sugar, but one can eat sugar, but in moderation, kind of throughout the day, scattered, with avoiding these big sugar surges.
Peter,
and yes,
some of my listeners might be kind of thinking, okay, he's saying I can have a little, because many people have tried the keto diet and has struggled with some of the problems of avoiding sugar completely. So do you happen to have a grams that you suggest, like per meal, like 5 gram, 10 gram? Do you have any suggestions for that?
If you want to be very strict, I would say 50 gram a day, which I know it's not easy, but the brain actually works on that pretty well. So that would be, 5 to 10 grams per meal. You should have at least four to 6 meals a day, especially when you have cancer and you have the GI issues. Yes.
Which we definitely want to go back to, and I'm so sorry I sidetracked you. So, yes.
Not at all. Well, about that, guts are very important. As I mentioned, 80-90% of our immunity is in there. All the problems that cancer patients have and all the things we put in their body with the chemotherapy and the antibiotics, they will change the guts a lot. And that will have an effect on the whole body. And the leaky guts, the bacteria, the toxins, they all get absorbed to the blood, and they will definitely contribute to problems. Now, how do we fight that? Whey by itself is extremely helpful to support guts. The other very important ingredient that we have in there is nucleotides. Nucleotides are building blocks for DNA and RNA, and one of the effects they do, other than they're extremely good for wound healing, is healthy guts. There's a study that shows people, or actually a microscopic picture of a gut mucosa from small intestine in a person who was not eating nucleotide supplements, where the mucosa is okay, but it's really short and unhealthy the way it looks. The cells are fragile. And then there is a picture with from a patient who has been on nucleotide supplements, and that's much more healthy, deeper recesses, bigger villi, healthy cells, thicker cells. So nucleotides, which we use in our supplements, are extremely helpful to support the guts. Other ingredient which is important is probiotics. I mean, it goes without saying how good probiotics are, and probiotics will help restore the integrity and the function of the guts. We have other ingredients that support, like bromelain, which is a digestive enzyme that comes from pineapple, very, very healthy, and zinc and other things.
Okay. And you also believe in prebiotics as well.
Oh, absolutely. Sorry, I have to.
That's okay. You're human. That stuff happens.
Yeah.
Yeah, I'm just so thrilled that you're giving us an hour. I mean, this is amazing. So.
No, absolutely. Sorry about that.
That's okay. So we were talking about the pre-probiotics because sometimes, yeah.
Yeah, the prebiotics are basically fibers that just create additional surface to probiotics to thrive on. Now, people who can eat good vegetables and whole grains and beans, legumes, crustaceans. They are not
cruciferous vegetables. A tongue twister.
Vegetables. They do well with fibers, but cancer patients typically don't do that, and many times they are recommended not to eat a lot of vegetables, especially when the white cells are low. So prebiotics and probiotics, which together are called symbiotics, are, I think, a very important ingredient of a good nutritional supplement.
Okay, and so this drink, the Power Onco, is this something that they would do each day, like for 2 supplemental meals or instead of a meal?
It can be taken instead of a meal or as a supplement. It's not very high in calories, as it has, no traditional sugar and no fat. It's around 100, a little more than 100 calorie. But what it does, it normalizes it helps normalize the integrity and the function of the guts, and helps the nausea, the vomiting, just overall the homeostasis. And we have had many people who were not eating at all and started taking it, and they started to gain weight because it made them eat normally as well. So once or twice a day, depending on how you feel, we typically, recommend it starting with the chemotherapy and take it throughout chemotherapy once a day, or some people take it twice. Yes.
Okay, and yes, and we hear that complaint a lot that I'm so nauseous or I have diarrhea, I can't hold anything down. So if they wanted to use more, is there any negative to using more if they just can't keep food down?
No, there's no negative, especially if they don't eat much else. They would have then a good amount of protein. The vitamins are in a dose that's necessary for cancer patients, but the dose is good to be used twice a day. One more thing I want to mention is the immunity. Beside muscle, guts, and a few other things, immunity is extremely important to support. I don't need to mention the decreased immunity in chemotherapy patients, but also cancer decreases. So some of the ingredients, the probiotics, the nucleotides are amazing to support the white cells, the lymphocytes, the neutrophils, all kind of cells. Without nucleotides, they can't really grow. And lymphocytes don't make their own nucleotides. So especially during treatment, one really needs nucleotides. And our supplement contains that. Cancer cells, on the other hand, make their own nucleotides. So we don't feed the cancer, it sounds bad, with nucleotides at all. That's been shown in a big study in Europe, where nucleotides is one of the 3 things that are officially recommended by the Cancer Committee of Europe. So we also support the immune system with vitamin D, with calcium, with zinc, with nucleotides, probiotics, and that's another leg, if you will, that our supplement stands on.
Okay, now I know we don't have time to go into a deep discussion about this, but another complaint often is neuropathy, and you definitely have a product that helps them with this. Could you just mention it and how they could use that also in conjunction with their treatment?
Yes, there's a product called Power Nerve that again is based on scientific data and utilizes natural vitamins in a form which is safer and better than the regularly used vitamins. And by that I mean that instead of thiamine, we have benfotiamine that absorbs much better. Instead of cyanocobalamin for B12, we have methylcobalamin, which is absorbing better and safer. Instead of folic acid, we have methylfolate, which is safe in patients with this genetic mutation called MTHFR. That is 40% of the population. And there are other ingredients like alpha-lipoic acid and nucleotides as well as glutamine. So it's a combination of vitamins and compounds that all been shown to support nerves. And it actually has been very effective in a lot of people, either with chemotherapy-related neuropathy, nerve pain, nerve damage, or with diabetic neuropathy. People with diabetes, 80% of patients with diabetes will eventually develop some nerve damage, neuropathy. We have had amazing success, over 80-85% in a smaller study we've recently done, where the pain is completely gone from neuropathy. People who weren't able to walk started to walk, even on pebbles and stones, and we just seen amazing results.
Well, we just have 2 minutes left, and I just really, from the bottom of my heart, want to thank you for the time this morning. You are so knowledgeable, and you have such an expertise on this subject, and I really appreciate you making this your mission and letting people have some hope and some really good nutrition during these difficult times. It's pretty scary when you get that diagnosis, and I think all of us have been touched by either ourselves or a friend or a family member, and we sometimes don't know where to turn. There's so much information out there, and a lot of what they call snake oil cures, and it's scary. So thank you for putting some legitimacy to this, and I really do appreciate this time.
Oh, thank you very much. I really appreciate you, and I'll tell you, I'll be there on the 8th.
For real? You're
yes,
coming? Oh, Hayes wasn't sure, so yay!
Yeah. and I'll be happy to talk to people and answer any questions and all that. So.
Wow. So you guys just heard it. So February 8th for the open house. Dr. Peter will be there. Oh, I am so thrilled. Have an amazing day, and I will see you next week. All right. Thank you
very much.
Thank you, Doctor.
Wow. Okay, that is so awesome. That just made my day, month, year. All right, so everyone, February 8th, 3 to 7 p.m., definitely want to come to our open house. Dr. Peter will be there, and Hayes works with him, and they're really a dynamic duo with information. All right, thank you, everyone, and talk to you next week.
Archives of the show are on YouTube under WPSL TV. Dr. Stuart Shipe's Holistic Health Hour is coming up next after CBS News. This is WPSL Port St. Lucie, the talk of the Treasure Coast, celebrating over 26 years and counting.